Welcome. I'm Sharon Kuhn, and this is the Total CEO podcast. And today I'm joined by my co-host, Dr. Peter Reish. And today we're honored to welcome Dr. Imran Ahson. In today's episode, we'll explore the intersection of oral and maxillofacial surgical excellence and human-centered care, while also discussing leadership, neuroscience, empathy, and humanitarian service. We look forward to hearing stories from Dr. Ahson's remarkable journey through medicine, dentistry, craniofacial surgery, innovation, and education, and the deeper relational dimensions of healing and patient care. Dr. Ahson, welcome. We're honored to have you with us today. And can you both share a bit about your training and current practice?
Sure. Thank you so much for having me, Sharon and Peter. I see Peter regularly because we both work for a large private practice group in the New England area, both in New Hampshire and Massachusetts. But just like Sharon said, I'm both a medical doctor and a dental doctor. And I went on to do some further training in craniofacial surgery. I ended up here in New England out of luck and am a faculty member at Tufts University, as well as doing a lot of different humanitarian trips and contributions throughout my years. So it just in general, I am somebody that really enjoys surgery. I'm somebody that has been able to kind of stumble into this field through luck and a lot of hard work, but it is something that's truly rewarding, and it's something that I really value. And thank you so much for bringing me on to talk a little bit about my experience, as well as talk a little bit about some of the insights that you bring to the table that I really think that would help us as medical professionals. For there any CEOs that are in the healthcare space that are out there, it's so important to understand emotional regulation, empathy, all of these different soft skills, because I think that coming in the future, we're going to be looked at less as technicians and much more as healthcare providers from a human touch. I think that a lot of the technological innovations that are coming down the pipeline are really going to be beneficial for all of us as humans. But what people are going to look for their surgeon, for their dentist, whoever it is that they're seeing at a healthcare level, it's going to be that human touch. And I'm really looking forward to talking with you about that today.
Thank you. Thank you. And Pete, Dr. Peter Reish.
Yes, Sharon, it's a pleasure as always. And it's so nice to have Dr. Ahson with us. I've known him now for 5 years. And he's just got such a background. He's got the private practice, successful private practice going, academia at Tufts University, where he works with students in the oral surgery department, does volunteer work with cleft palates, he does podcasting. I think the only thing you don't do, Dr. Ahson, is research, but maybe you're doing some I don't know about. I wouldn't be surprised. Um, but yeah, a pleasure to have you. So I've been an oral surgeon for 30 years, in private practice on the seacoast of New Hampshire for nearly 25 years. So I always practiced full scope oral surgery until the last 5 years. I did have one health issue and kind of pivoted, and have just been focusing on TMJ and a little pathology over the last 5 years. It's an area I'm very passionate about, a lot of patients in a lot of discomfort and pain. So it's really been a pleasure to continue with that and finding this passion with emotional intelligence and potentially helping our future generation of students, medical and dental students. I think we can learn a lot from Dr. Ahson today.
Thank you. I appreciate both of you are valuing what empathy brings to the table, what it brings to your own resilience, because we know when your passion is connecting, to patients, then we've got that feedback loop, right, of bonding chemicals and the highest human form of really those feedback loops that encourage healing and encourage resilience. So I appreciate both of your valuing the power of empathy in your work. And Dr. Ahson, you began in biomedical engineering before pursuing dental and medical degrees. What first drew you toward the intersection of engineering, medicine, and surgery?
Yeah, I realized very early on that I was a people person, that I loved interacting with people, and a lot of engineering these days, at least in all of the engineering classes and internships that I had in college was sitting in front of a computer, very little interaction other than basic office water cooler talk until you go back to your computer, and I think that at that point when I was in engineering, I thought to myself, I have to figure out what I'm going to do. This is not the career for me. I was interested in science. I was interested in physics and biology, which is what drew me to engineering. And so I shadowed a number of different people. And I shadowed a neurosurgeon, I shadowed an internal medicine physician, I shadowed a dentist. I have a lot of people who are in dentistry in my family, and one of them had recommended me shadowing an oral and maxillofacial surgeon, very similar track to what I'm currently doing. He had done both medical school and dental school and craniofacial fellowship and was doing overseas work. And this guy was just such a charismatic individual that I looked at him, I was like, that's the guy that I want to be. And I think that's how it happens for a lot of young folks is they see somebody that they see that they want to be like, and they start pursuing that, and then they just fall in love with whatever field it is. And that's truly the case for me. I think that a lot of it had to do with luck. But the science background was a prerequisite for all of the potential careers that I had chosen. And I think that that's something that whether you're going to be in medicine or dentistry, it is emphasized as something that is first and foremost the most important thing that you would need to become an excellent care practitioner. I realize now that those soft skills that we kind of alluded to in our intro is equally as important as the other stuff. And that's what I had kind of picked up on when I was younger, that I just enjoyed being around people and talking. And today I get to see 30 patients a day. I have, brief conversations with them. Each one of them, those conversations for me, because I'm an extrovert, is not something that drains me. It's something that uplifts me. And so that's one of the reasons why I ended up where I'm at today.
Excellent. I can imagine that when we're a charismatic person, if I'm one of those 30, I feel that. I feel that energy, right? So we're sort of marrying that charisma, that sense of connecting with people, influencing people, being an influence and an impact on them with the technique that we want to bring to them to improve
Mhm.
their lives. So that's fantastic. I love hearing that. That's what Pete and I have talked most about.
Yeah, and you touched on a very important topic too. I think the mentorship, Dr. Austin, it can be, critical in the beginning of our career and choosing careers. But I think even working down the line, it's essential, in my humble opinion, to have a mentor you can go to and continue to discuss cases, techniques. You go into private practice from dental school, it's a big jump, and to have someone to bounce ideas off of. It's one of the things I like about the group NHOMS is we can all bounce ideas off each other. Um, and that's something that students should really try and hold on to because it can alleviate a great deal of stress when you know you're practicing in an arena that you've considered all the options.
Yeah, absolutely. And I think that that model of having a group practice is pretty atypical. And people don't realize that, from a layperson's perspective, like most of medicine or dentistry is a solitary existence. Unless you work in a hospital system, like if you're a family care physician in Iowa, you don't really have a ton of interaction with anybody other than your immediate staff. I mean, you're obviously seeing your patients and things like that, but to have true colleagues that you can bounce ideas off of and just not feel like you're on an island, I think is really something special about a group practice. And it's just not as common as you would think these days, and a lot of people don't realize some of the stressors that come from it and how isolating it can be when you don't really have that safety net of people that you can talk to.
I was just thinking that human component that you share also gives you those bonding chemicals that you actually do bring to your patients. So I'm such a nerd on the neuroscience of saying, hey, affect is our primary language as human beings. and for the doctor to be sharing that affect with their partners and their staff. And then that translates to the patient. We know that cortisol is going to go down, oxytocin is going to go up, and we're going to be influencing their trust and their healing, correct? They're going to be more putty in your hands where you're working together. Literally, the unconscious mind and body is allowing doctor to work with me. It's so strange for the body, isn't it, to say, wow, here's someone who's kind of a stranger, right? Being sort of invasive, but it's care. So that's a lot that's going on inside the human body of both the practitioner and the patient, and recognizing all of what you bring to the table when you have those mentors and you have those trusting allies, that certainly affects your patient's outcome. So when you think back on your practice, Dr. Austin, did any specific practices where you think, these behaviors or not doing these behaviors, or what did it look like in the interactions that most affected your patients?
Yeah, I think that oftentimes people want to have some sort of connection with their healthcare practitioner. Like that. The days of yore where there was this paternalistic relationship where I tell you this and you are going to do this is gone. People trust every institution less now than they ever have in the past. And especially with healthcare, right? Like you have WebMD and all these other competing information sources. So when I come in and I tell them something, if I don't have that connection with that person, then realistically it's hit or miss if they're going to actually do the treatment that is going to benefit them. And so, to convince people to do things in their best interest is the age-old question of medicine. It's something that, every single field, every single healthcare practitioner has to deal with, because we can only do so much. And at a certain point, it's on the patient. And also for them to trust us with whatever treatment plan that is entirely in our purview. Like there's very good literature to show that if you feel like your doctor is looking out for your best interest, they're less likely to even if you get through a complication, they're less likely to sue. They're more likely to undergo further procedures to fix whatever problem it is that was created in the first place. And so I think that the most powerful thing for me and for any healthcare practitioner is to create that relationship with somebody. And you can do it however you want to. Me personally, I really like to invoke humor and get some sort of mutual conversation topic, because again, I just really like talking to people. So every opportunity to talk to somebody is another potential conversation for something that I'm interested in. Here in New England, the Celtics, the Patriots, the Bruins, these are like the sports that people are following. And so I'm a big basketball fan. And so I'll if I see that they're wearing like a Celtics jersey, I'm going to talk to them about the Celtics. And it makes it fun for me. It makes it fun for them. And chances are that creates a relationship where they're actually going to follow through with whatever I ask them to. They're not going to look at me that this person is trying to, swindle me or, get me to, pay a lot of money for something that I don't really need. So I think that is the most important thing in 2026. I think it's just going to become more important and more influential as we go into the future.
Yeah, I appreciate that. I appreciate that. I'm noticing, right, that making that connection says we've got trust between patient and doctor. And I'm going to jump ahead a little bit, but then we'll go right back to what we're talking about. So, patient trust says, if you impact me about my oral health, I'm going to be more likely to take care of my oral health. And we know today that that is brain health, right? And so the way these systemic things take place between the interactions and the trust and in interpersonal neurobiology, we're going to call it the gut brain, is picking up on you. And then we've got that trust. And then the head brain can actually give me the disciplines that I need to actually go home and do the care that I need to do after a surgery or just after any type of a treatment. So this is just such a holistic approach, which is why it's just so beautiful to have this conversation and why I've so valued Dr. Peters' influence in my work as, we've been doing this together. So I just love everything that you're saying. So, if you were to give advice to new surgeons on maintaining humanity and compassion in high pressure environments, does anything come to mind?
Oh, that's tough. You know, I think that the first thing that I would say, and I'm interested to hear Peter's perspective because he's been in practice for quite some time, also, is it's so easy to get burned out. It's so easy to have one mistake, or not even mistake, one bad situation cloud your perspective going forward. And I think that the separation of caring enough and caring too much is like you have to learn where that is, right? Like if you're any sort of healthcare practitioner, you're going to have complications, and or things are not going to go well. And if you think about it too much, or you absorb sort of the negative energy that a patient might give you if they've had a bad experience, it would be so easy to be like, okay, you know what? I'm just going to not care about in the future. I'm just going to do my job and be a technician. And I really think that that's a loss, not only for the surgeon or healthcare practitioner, but also for the patients that they're treating. So I would say that's like the biggest thing, because everybody that goes into the healthcare fields has that inherent empathy. Like you wouldn't choose to do that unless there was some spark there to begin with. So lean into that, but then just don't let the bad experiences burn that ember, that fire, that empathetic fire. I would say, let them wash through you. Go and I'd love to hear any sort of coping mechanisms that you have, because I'm even myself dealing with it, right? Like even at this stage of the game, I'm still having patient experiences that still stay with me. But I try to spend time with my family and not think about it, and go into every patient as a clean slate, or every patient experience as a clean slate. Even if somebody I dealt with had a bad experience in the past, I try to just forgive and forget, and move on, and treat them as if that thing never happened. Because oftentimes access to care in our country is so significant that they might not be able to get another surgeon to look at them. And I might be the last stop. And oftentimes in oral and maxillofacial surgery, we are the last stop in the road for a number of different pathologies. So if I'm not able to treat them, then oftentimes they will not have the opportunity to be treated at all. And so if I, just get frustrated and dismiss them, then that might be, really difficult for that patient to get care otherwise. So I think, just don't lose that fire, don't lose that empathy by letting the bad times cloud your judgment. But Peter, Dr. Reish, what do you think? Is there anything that you would give advice to, like a young surgeon or a young healthcare practitioner,
Yeah,
in how to deal with
sure.
that kind of stuff?
Yeah, sure. I could speak to it a little in the sense that, I mean, you touched on, trust is going to come up again and again in this. And, beginning with that trust with a student and their mentor, it just keeps giving and paying forward. We've had many discussions. I love talking with Dr. Ahson. He's a very thoughtful, forward-thinking doc. And I'm going to bring up the trust as it relates to a hot topic these days, AI, in just a minute. And Dr. Ahson and I have spoken about that in the past. But the advice really would be, let empathy shine through. Don't be afraid, be humble. Let that empathy shine through. Let the patient know what you're thinking and feeling. And then that's going to make them trust us more. And you can reduce the pressure, I feel. I always tried to reduce the pressure because it is high stakes, high pressure stuff we're doing. Um, So for example, there can be 3 or 4 choices for each surgery. I would like to have long discussions with my patients and really let them pick, let them invest in the treatment, and then just try and do the best job I could at that. I didn't want to sell them a treatment that they weren't going to really be into, because that would make it stressful for me, or I think for any doc. Um, you have to know your stuff. If you're doing a procedure you don't know a lot about, it's where that trust comes back in. Go back to your mentor, learn more about it before you do it. You can't be, stressing about the techniques of a procedure. And then we always have the option for, anesthesia. If you have a difficult patient, we can sedate them, makes it a lot easier for us. Um, if they're awake, I really found just talking through the surgery with the patient, verbally, literally letting them know this is going to happen. I'm going to give you the local. You're going to feel pain. I'm going to come back to you when you're numb. We're going to make sure you're numb. Just constant talking. And that's where, going back to this AI thing, we really have an advantage on AI, on the robots in the world. We have empathy. We get a reward for it with oxytocin coming out of our brain. If and robots don't. We have that feedback loop, but our patients also benefiting from the feedback loop with oxytocin. I even pulled this article aside, Dr. Austin. Um, this is from the December issue of 2025 from JOMS. Can chatbots provide accurate and readable information for patients with TMJ disorders? And it's funny, one of the findings in this was that the patients weren't investing in the treatment because they felt that they couldn't trust the AI's decisions
Hmm,
for them. And it's just
interesting.
amazing. It's just something we're going to always have. And it's those biological signals that Sharon could speak to more than I can about, your stress, cortisol is released. It's not a good place to be. It doesn't feel good. You get in a happy place where you know your stuff. You walk in and do that consultation with someone and you know your stuff. And you're talking to a patient, the oxytocin's being released, and it feels good to go to work. And that's what I hope students can find, because if you're in that cortisol level all day, it's not a good place to be.
No, it's not.
Sharon, can I ask you a question? So, sometimes in dental school, we'll talk to we have a class about, connecting with your patient, and they teach you small little tricks, mirror what the other person is doing. Like if their
Mm,
hands are folded, then you should fold your hands also.
okay.
If they're like running their hands through your hair, then you should do it also. Just mimic
Really?
that. Obviously, direct eye contact,
Yeah.
speaking at their level. Those things are important. I guess my question to you is: Do you is it a chicken or an egg situation? Like which comes first? Is it that we learn these things and we get better, or is this something that we just have our inherent nature and this is just icing on the cake?
No, I love that question. So some of us are born with something a little different in our right brain. Some of us are born a little more left brain. And some of us with a little bit more in that right brain behavior where it's more conscious. We know from the work of Antonio Damasio, that's going to be UC San Diego, that he's looking at emotion as I'm going to call it sort of like a chemical soup running throughout our body, right? And that chemical soup is driving about 95% of our behavior. So to your question, some of us are born more right brain. We're just going to kind of lean more that way. And some of us are going to be more logical than emotional as far as consciously, but the body's always running on that emotional awareness. That's that vagal tone, the vagus nerve, just constantly sending us signals. And so some of us who are more right brain may be a little more aware of that. So more aware of it. And some of us have to practice more awareness of that. Does that make sense? So that's really the work that Dr. Pete and I want to do is to bring in techniques to understand, am I more this way? Am I more that way? If I'm born more likely to be aware of my own signals and others, that is where I need to do more self-protection to self-regulate, do those calming resets and have those techniques where I'm keeping that regulation under control for myself in order to, be fully present to treat my patient, not just, interpersonally, but with the highest technique. But then if I'm more that left brain logic person, that's fabulous, right? Because I'm going to be so aware of the logical things that I need to be doing. I'm not going to get hooked into emotionality or hypersensitivity, not even for a few microseconds, but I'm going to have to practice a little bit more of that softening and that mirroring. And I've noticed with some of my clients who are, executives or CEOs and having trained my model in a behavioral health hospital where we had outpatient psych and outpatient substance abuse, one of the most important techniques was left eye to left eye,
Hmm.
or then right eye to right eye. We're going to get right brain to right brain. And try this out. Almost always, if I've got someone mainly in my right eye and I'm needing to really make an emotional connection with them and they seem kind of far away, if I go into their right eye, which is going to cross over, right? They'll almost always immediately come back to my left eye. It's almost like they're trying to get you back. It's so unconscious. So, these techniques of what do we do if we start to feel, if I'm going to be more left brain, my body might kind of signal some annoyance before it signals some sensitivity. If I'm more right brain, it might signal some sensitivity, some reaction to somebody's dislike of the being at the dentist or whatever all that is, right? Or their pain. And I might need to regulate that. So just knowing ourselves. Am I even answering your question?
Yeah, no, I think that really helps. I mean, first off, that trick was really interesting because I've never heard about that. I'm going to try it tomorrow. But more importantly is that I think that what you answered was, people definitely have predispositions, but I didn't know if we do these things, does that make us more empathetic? Is this like, for example, like when we have that connection with someone, or we're trying to mimic that connection, does it matter? Or like if you go through the motions, like if you're naturally physically gifted, you might not have to work out a lot, but if I work out a lot, I could get to that level where that person is naturally that as that person who's naturally gifted. So, is that possible? Like, is it possible to get there, or is it just you're born with what you have?
I'm going to go with this, and this is what I see, and I believe that we can find literature to support it exactly the way we're asking that question. So let's say I am a dentist who says, I want the outcome to be fantastic for this person. I went into dentistry because I love to transform lives. However, I don't now. This is going to go into attachment, so this is going to be a whole nother podcast if we choose to do this, okay? But if I sort of grew up where my culture or my family toned down emotion, my brain learned to do that. But human beings are born to emotionally connect. So I can get that back, right? So some
Hmm.
of us are going to say, you know what? I kind of was born a little bit more left logic, grew up in a culture or a family that kind of toned down emotion. And so that could end up being somewhat of a dismissive, emotionally dismissive style. And that doesn't mean I'm dismissing the person. It means that my brain and my body are dismissing sort of that sensitivity going on, and some of those signals just don't give me the correct interpretation on that level, that soft skill level, and I can learn it. Now, here's the key that I think could be different, and however you guys hear me say this, like help me fix this if it doesn't come across clearly. When the dentist or the practitioner wants to connect, their brain will get that oxytocin. That's what it's built for. The brain is amazing at doing what it's made for, right? Um, if we have someone, and we know that with, it's if someone is, more, I don't want to use this word like sociopathic, but in any industry, we're going to have some people that can be much less humanitarian oriented, right? And that person may not be looking to connect as much as to connect to control. The patient
Mm.
will feel that. And we want to notice that when working with students or other doctors. And here's what I feel like is a power that we have as human beings. And this is the work of Dr. Paul Zak. He wrote Trust Factor. He calls oxytocin the moral molecule. When we show someone any degree of connection or trust, we're um, we are influencing their brain to release that oxytocin. And so we want to have empathy for an unempathetic person so that we can actually give them those signals until their brain recognizes them and feels safe enough to receive them because there is a vulnerability involved.
Mm.
Right. So I don't want to hijack our conversation from dentistry and take it into just the neuroscience of empathy entirely here, but I believe that it all really does fit into the beauty of how the best dentists actually impact their patients for healing.
Yeah,
Yeah,
and
no,
even
I don't think it's hijacking at all. I think it's important skills that people need to know about. And I think we do a very introductory lesson for that for most dental students, medical students, whatever. I think that a lot of it is kind of just like on the job training. And
yeah.
would you agree, Peter?
Yeah, well, and I think you brought up like that class, the folding the arms, the combing the hair, kind of along with the patient. That shows that the doc's at least trying to connect, right? And patients, even if the doc's an awkward doc, right? Because some people are more gifted at this than others, the patient will recognize that they're trying to connect, right? So
Uh,
I think that is an important part of exactly what we're all talking about. Yeah, and just to touch on that, Dr. Austin, at the school, you're right on the front lines there. Are you noticing um, some of this with your students, like your first year oral surgery residents? Do they seem more stressed than the seniors? I mean, are they mentoring each other?
Yeah,
What's your,
I think that a lot of it kind of deals with what Sharon is saying. Like some people are just more adept at it than others.
yeah,
I do feel like for most people that undergo rigorous academics and for such a long time, that uh, I just maybe this is just my perception of them, but
yeah,
everybody's like a little awkward, like I think that's part of the practice of becoming a physician or a surgeon or a dentist or whatever. It's like how to deal with people in like a smooth way.
mhm,
That's part of the learning that you do for the rest of your life, the how to
yeah,
deal with people. And so initially I think that when they come in, regardless of stress level, they're all like a little bit difficult to like connect with patients. Like they look at patients so much as just like tasks on a list, right?
right,
They just need to
yep,
get through the day and finish seeing all these patients so that they can go home and rest for the next day. And I think that as they get through the program, they realize that connecting with people, I wouldn't say like manipulating people, but like guiding people through their treatment becomes easier for them,
mhm,
guiding them to do the right thing, guiding them to show up for their next follow-up appointment, take their medications that they're supposed to do. The seniors are definitely better at it than the juniors.
yeah,
And I don't think that that's something that's a function of stress level, because I think that they're both equally stressed. I think that the juniors might have more on their plate and they're more to learn. But I think that the seniors are stressed out about where is my next job going to be, and
right,
like I have
right,
this big surgery tomorrow and this person is expecting, like, so the stress, like it's pretty much the same
yep,
regardless of what position you're in, from my opinion. It's just I think that as you become older and more mature, I guess you could say, like the ability to deal with people is completely different. And honestly, I think that's the same for just aging in general. If you truly want to become better at social skills, there's a significant difference between like a 20-year-old and a 40-year-old, right? And like
yeah,
you're constantly working on it. I remember when I was in residency, both my co-residents were over the age of 40. One was 40, one was 44, and I was 26. So I was just totally out of my league, but I learned so much from them, like the way that they handled everything. They were just much more smooth, much more polished. And I think that that is something that is just a constant, ongoing life process.
Mhm.
Yeah, I mean, would you say, is it a fair statement? Would you say that because, my education was longer ago, my residency 30 years ago, but we had no training on emotional intelligence or connecting with the patients, that we can do more? Because I feel if we can prepare these students with a little more emotional intelligence, it'll pay off exponentially in their careers. Do you
Mhm.
think that's a fair statement?
100%. Yeah,
Yeah.
100%. Like I was saying earlier, is that, I think that with all of the distrust that's out there, with all of the, I would say, lack of value of the technical aspects of our field, because of AI and everything from a technical perspective is becoming easier. I think that those soft skills are just going to be that's how people are going to determine if this is somebody that they want to see or not.
Yeah.
There, and that's
Agreed.
something that I've seen in my own practice, that they've seen X number of surgeons beforehand and they went with me because they just had a good feeling.
Yeah.
And I think that we're on the tip of the iceberg with that, right? Like I think what's
Uh-huh.
coming down the pipeline is that the majority of healthcare is going to be through AI or robotics or something like that. So realistically, your interactions with humans are going to be less. So therefore, each one of them is going to become more valuable.
Yeah, and I think people are going to be reluctant to sign on to the treatment plan unless they have that connection or opportunity for connection with another person.
Yeah,
Um,
or just like the respect of the institution, right? I think that like
yeah,
if you're associated with like Harvard Medical School, like people will sign on the dotted line, but when you're in rural New Hampshire, you don't have access to a place like that. And so, you're going to go to whatever healthcare practitioner that's closest to you that you feel like you have the best connection with.
Mhm.
I'm going to Tufts, but anyway,
He's joking because that's where I work.
I'm
Yes.
not joking. Not
Yeah.
joking.
And that's your alma mater. So,
Yeah.
yeah. And so, can I go back to a technique again?
Yeah,
Because I'm hearing something that I like to call the dance. And Dr. Austin, I'm hearing you describe it. And Dr. Peter, I know that I always hear you describe it. It's the dance, right? The mirroring says that there's this going back and forth. And there's this kind of funny phrase, okay, but it's true. It's true on a gut brain level, is that what is shareable is bearable and makes us bondable. And the way the science breaks that down is if one of our techniques with an upset or distressed patient that needs our co-regulation, right? If what we're doing is using um, we, us, our, and we're mirroring, and we're doing that. I like to match people's pace. Okay, so if they're going kind of quickly, even if they're sitting in a chair, you can kind of feel, if they're moving kind of quickly or if they're kind of sitting there more, and I'll match that. And so they'll feel that. So what we know is that any amount of using terminology, words, oh, no, I love this one. If we don't have words for a few seconds with a patient or a client, for me, it's clients and guests, and for you, it's patients, the power of oh, those things are powerful to vagal tone, which comes up, and will notice that they feel felt, seen, and heard. And now anything that we share back and forth, whether it's scary, whether it's reassuring, whatever it is, if it's shareable, we just moved something uncertain from the unconscious mind up to the conscious mind. And it's this part of the mind where the whole brain works together. And that's now where we're collaborating, we're innovating together, and trust is built. So those are simple techniques, and they're the techniques that we do, that friends do, that lovers do, that great people do when they're influencers. And that's what we really want to see our clinicians have this impact. because we know that if we're bringing the cortisol down, the trust chemicals up, then the immune system is going to love it, right? And the immune system and the heart brain is going to be drawing them back to you and sending them home, remembering the things that they're supposed to be doing in that self-care between visits, whatever, the follow-up, all those things. So I know it sounds so soft. What is shareable is bearable, but makes us bondable. But what we can share is going to change the chemistry, raise oxytocin, which the immune system is going to love. And that is a part of healing.
Can I
So,
ask you a question for personal benefit?
sure.
So, what would you do for the other side of empathy, which is when you get overwhelmed by, let's say, a complication or, a patient that has, bad behavior or irate at you? How do you deal with that as somebody that is just naturally more sensitive or empathetic or whatever adjective that you were using earlier?
Yeah, okay. So it's different things for different people, but off the top of my head, I would say, right. So we customize tools for different people to understand their own signals. But we want to check in with the body first. Okay, the body keeps the score. The body really knows what we need and what we're experiencing and how much it can handle and how much it's not willing to handle, right? Because so I like to think of the body as sort of the earth suit that is built for survival, and the identity within is built for relationship. And it's the body's job to turn on survival mode, turn off relationship mode when the body's too overwhelmed. So knowing the earliest signals that might be for one person, that inside their gloves, their hands are just too sweaty and clammy. It might be for another person that they're noticing their heart is ready to beat out of their chest. It might be for another person that they actually feel a lump in their throat. They might feel angry, they might feel teary. And so we want to work with our body first. We want to check our breath. We want to check our pace. And if it's possible to do a slight exit, maybe that's a mental exit for a moment and we prepare those ahead of time. Maybe it's a physical exit for a moment and we come back. And we might want to train our staff what our exits are and what our resets are. So in the, we may have a lot of times I'll work with people and they'll have a logo, that we use, and that helps them get back to a centered, grounded place. So does that answer your question? Are those some things
Yeah.
to
What
imagine?
do you, a logo that you use? What do you mean by
Yeah,
that?
so in some brain work, there's a particular method. It's a brain reconsolidation method, and so I'll work with someone for a little while, and I'll say, when you're at your very best place, um, what is something that comes to mind that sort of metaphorically represents you? And they might say, I don't have anything like that. And I'll say, let's take a few deep breaths and see if your brain gives you something because it has something. And they'll be like, well, I don't even know why this came to me, but a canoe or an owl or a jet or a bridge, something will come to them. I'll be like, what do you feel in your body when you think of that? And some people have to be trained to feel their body, and other people are instant, like, whoa, I feel that right here. Or wow, I feel refreshed. Or I just feel like I'm free. I'm not trapped in that feeling I had a minute ago. Okay, cool. Let's keep that logo. And we have to change it from time to time because brain loves novel. Okay, brain doesn't want to get bored. So some of those techniques are the things that we can help people understand their signals, take care of the body made for survival, and the identity nested within that's made for relationships so that they can come back to that patient with their empathy. And if they can't, they have to say to themselves, it isn't time for empathy. My brain will get back to that. Right now, I'm doing technique and I'm going to fake my empathy as best as I can because that's the best outcome for my patient.
Hmm.
Yeah,
Yeah.
and just to speak to that, it is kind of fascinating. It's a good question, Imran. I felt over the years I learned mine was when I would be angry or frustrated with a patient. That was kind of when I wasn't connecting with them, they weren't getting it. And I learned to recognize that. So, because you should never be angry with a patient when you're trying to treat them, it's their care. But either, I was feeding off of their anger or something else. And what I learned to do was to just actually just ask them over and over kind of how they're feeling. And I would speak less and less and almost sit there and wait for them to respond. And then then they would start coming out and you'd find out like what the disconnect really is, what they're really upset about. I think for me was figuring out that one problem.
That's
Mhm.
excellent. I love that. I love that piece of asking them more and having them talk more, and then they're more felt, seen, and heard.
Yeah, I would stop telling them anything and be like, okay, tell me how you feel about that again. And I'd say nothing else, even if they're just kind of sitting there with their head down or what. And you just sit and wait.
Mhm.
Anyway,
No, I think that's great. I, Sharon, when we were talking about like people that we go to, actually, Peter is the guy that I go to for the soft skills, just because when I think about like the type of person that I want to be like when I'm practicing, I think about Peter Reish and the you should hear like the things that his staff says about him even to this day. Like they're just so thankful that they got to help him when he was, operating at his full capacity. Like we had this interaction with like another surgeon that I was just so pissed off about. And like he was the first person I thought I just need to talk to Peter. And that was like such a weight off my shoulders. So how do you create a relationship like that if you don't have one? That's something that I feel like I wish that I could tell to the younger surgeons that are working in our practice, like, hey, like, you can talk to me about whatever, but so few of them take me up on that. I feel like I'm very quick to call somebody and be like, can you believe what this happened? That's just because that's the type of person I am. But how do you foster that relationship in people who might be a little bit standoffish?
Yeah, I think actually putting it out there as some of us, like, by the way, guys, a part of your resilience and your long-term satisfaction and referral is going to come from the fact that you can stay um, in your passion and stay in your joy, the joy and energy of work of this work. And so you might even just like take a poll, right? Like, guys, let's have this conversation where how many of us grew up where we were allowed to ask for reinforcement emotionally, or allowed to ask for reinforcement even in our technique. Maybe we were supposed to, show up and perform and achieve and prove and prove, prove, prove. And when you were talking about stress earlier, whether it's, seniors and this kind of stress or juniors and that kind of stress, if we're constantly proving and we don't get to just be with people, then we didn't learn the art of being with people and letting our guard down. And that's an art I think we need to recover in our culture all the way around, right? We're teaching cognitive skills to children who are 3 in preschool. It's like, no, friends, no, no, no. They should be exploring what it's like to just feel and smell the world, not doing cognitive skills yet. Like, we've got this all wrong. So I think having those conversations and having them, sometimes I'll ask people, like, on a scale of 1 to 10, you don't have to show me your answer, but if you want to, and if we want to even break into tables and share answers on what's true for us, on a scale of 1 to 10, how comfortable or likely versus uncomfortable, not likely is it for me? And my body got patterned to know that I'm safe and familiar with that, or not safe and familiar with that. So, especially with medical students, when we bring it back to the biology of the body, I've got the patterns for that, or I don't. I was born a little more right brain and maybe likely to let my guard down, or even more sensitive to keep my guard up. What is it like for me? So, it's self-awareness and inviting those conversations, and then creating, experiences and telling our stories where we're the model of, being vulnerable and letting our guard down, and how it had a good outcome of reinforcement for confidence and satisfaction and passion. We can keep our passion online and
Hmm.
sharpen it
Yeah.
with one another, sharpen it with one another.
yeah, I think that humbleness part is so important. And Dr. Austin, I'll certainly, attest to your humbleness and that connection with your staff and your patients. But everybody feels that and is so much more accepting, I think, of treatment. I mean, you were able to pull a difficult staff together so well in like I don't know if it was 5 or 6 months. Um, but you mentioned like the Celtics finding something in common with the patient. I think that's a way to teach young students to really connect with their patients, to really spend time, maybe even look at their history, find something you have in common with them. Every single patient in that chair, you have something in common with. And if you can make it, even if it's one of those difficult patients, if you can just maybe find that one commonality, I think it can help. Um, pets, what are you doing this weekend? Any travel plans? The travel plans one seems to work really well because everybody's got usually a plan down the road somewhere. And before you know it, you find out you're both Celtics fans. Pretty cool.
Hmm. Absolutely.
Even though it was a rough year for the
That was a tough
Celtics.
year. Yeah.
Beautiful. Guys, this has been such a great conversation. I have a closing question, but I don't want to cut off any thoughts.
No, I'm ready to hear the last one.
Okay, here we go. So, what legacy do you hope that your work leaves, not only surgically, but humanly?
That's a good one. Yeah, I mean, with two young kids, like I always want them to look at me as someone that really had an impact on the world, that did important work
Mm.
and was a benefit for mankind. And certainly I'm doing that every day with my hands, but I hope that if I had one message that I could give to your audience or to the world is that, the connection between oral health and systemic health is so real and so undervalued in society, but overvalued in our brain, right? The idea of the amount of energy that is devoted to just sensation from your mouth and your lips and your tongue and your teeth. Like if you were to draw a somatosensory cortex map of the brain, it's like half is the mouth. And so much of our brain power and what it is to be human happens right here, whether it's speaking, taste, kissing, what have you, that the mouth is responsible for. And for some reason, there's just this separation between medicine and dentistry. I don't see it because I have a background in both, but there is not enough connective tissue between those two fields.
Yes.
And I feel like other than just being a good dad and a good provider and a good surgeon, that is what I would want everyone to know, that the care that you take for your oral cavity and everything that you do to promote good health in your oral cavity has dividends in your brain, in your endocrine system, in your heart. And I could have a whole podcast about that. It's something that I love talking about. That's where I do research. So to credit Dr. Rishi, he's like, the only thing I don't do is research. That's where the research is that I'm
Okay,
doing. So
nice.
so I am doing some, but not as much as I should, because I do feel like I want to get that message out there. And thank you, Sharon, for giving me that platform to at least comment on that.
I so appreciate that. It's just beautiful. I love what you just said, and this whole systemic part is so important to me. The interdisciplinary, yeah, recognition of that, and the closeness, right, of this oral cavity to this tissue, especially that prefrontal cortex. Oh my goodness. But is it true that the back of the throat, right, is sitting right under the hypothalamus? Like this is just right here in our brain. So we
Yeah,
must
and more so than even
look at.
proximity. I mean, like the for example, chewing uh is been found to have cognitive benefits. There's a very clear correlation between the amount of teeth you have and how long you live. If you were to look at all of the 100-year-olds that are in existence, the majority of them have all of their teeth, or at least 20 tooth chewing surfaces. So
Yeah.
there's a lot there, especially for your field, like the benefits of having good oral care and using your mouth appropriately, whether it's for breathing so that you get good oxygenation to your brain, whether it's for chewing, like the cognitive benefits of chewing. There's just so much there that I don't think that most people know about.
Yeah. Dr. Peter, what would you say? Thank you so much. That's fabulous.
Well, I actually have, I can't let Dr. Austin go yet. I have a question for him. There's
Sure.
just too much good information here. But I wanted your thoughts because going forward, I think this could help students, help Sharon and I understand better. But do you feel with the emergence of corporate medicine, corporate dentistry, these big DSOs, everything taking over, do you think that's going to help or hinder the medical profession and specifically the quality of care for the patient and the quality of life for the healthcare provider? What are
Mhm.
your feelings?
Yeah, I mean, I think that there's pretty clear evidence that shows that once a private equity company gets involved, that the patient outcomes go down.
Yeah,
And I don't think that's the case for every situation, but uh, from the anesthesia literature, from the internal medicine literature, if
yeah,
a hospital system gets bought by a private equity company, their aggressive profit making practices will be something that drives healthcare outcomes down. That being said, one of the benefits, if you have to find a benefit, is the fact that they do expand the net for people who can be seen at that hospital. So the access to care issue becomes less of a thing. It's just when when profit is your number one factor, you might get saddled with enormous amounts of debt. You might, there's lots of other pros and cons to the whole situation. I think right now we're living in a particularly negative time for that interaction between business and medicine.
mm,
I'd like to think that the outcomes will be better. I mean, for so long, the American healthcare system, because of a free market economy, was outperforming other countries and in all these different healthcare metrics. And now it's not. Our life expectancy is going down in comparison to other countries. Other countries are outpacing us that have a more socialized medicine profile. So I think that right now, if you were to say, like, if it stays like this, is what is going to be the outcome? I don't think it's going to be a positive outcome. That being said, I just don't think that this system is sustainable. I think that there has to be some sort of change, and that's the great thing about the American system, is that you can change it, right? Like, you can't. It's not, you're not beholden to what has happened in the past. And so I think that everybody kind of feels that. Everybody feels like this system is not working, that people are not getting healthier, and people are at least talking about it. I don't think that was the case even 20 years ago. And
yeah,
so, I think that it's gonna change. I think it has to change. So whether that happens through legislation, or these companies start becoming more active in healthcare outcomes, I do think it will. Mark Cuban, for example, big amount of capital, has seen the problem and he wants to fix it. And if it can come from like the free market economy, and the problem gets fixed because the prices go down and access to care increases, I think that's great. So that might be an iteration of more involvement from the private sector that brings out better health outcomes. But again, if you were to ask me right now, I would say it's not good for us.
Mhm.
yeah. And I fear it's going to be, at the cost or expense of the medical professional, the new medical professionals coming out in the short,
Yeah.
at least in the short run. You're right, because hopefully things will adjust and pivot. Yeah, and the private care, it's interesting. I saw something. James Taylor just donated 174 million for a homeless shelter. So yeah, hopefully there'll be more and more people like that, creating models that are hopefully successful that we can follow where it's not 100% financially driven.
Mhm.
Mhm.
So we need Elon to invest in, some sort of big,
Something has to change. Yeah.
yeah,
And so
But
we're a part of that change is bringing in the
yeah,
emotional health
talking exactly,
awareness so that we're protecting the patients and the clinicians that are trying to serve uh,
exactly.
in this day and age, right? So
Yeah,
that we marry a highly human-centered mind, collective mind, to a free market.
yeah,
That would be a beautiful thing.
yeah,
yeah.
I agree.
Well, thank you so much, both of you. This has been an excellent conversation. I'm positive that our audience is going to enjoy it and learn a lot from it. And I just thank you for joining me today.
Thank you,
Thank you,
Sharon.
Sharon. Thank you, Dr. Austin, for taking the
Thank you,
time.
Peter.
I know, I mean,
Yeah.
he's been working all day, this guy, and he's here doing this.
Yes.
Yeah, but it's fun. It's nice to talk to you. I got a couple tips from it myself. I'm going to start using tomorrow. So I really appreciate the opportunity.
Yeah, and Sharon, I forgot about the left eye thing too. I was going to go, and then I forgot to do it. So I'm going to start doing that more too.
All right. I think that's sweet. I'll tell you what, infants are the best. Infants are the best at it.
Oh,
We're born
really?
knowing these things. We're born knowing these things.
Oh, that's funny.
Dr. Ahson, Dr. Reish, thank you so much.
Thanks,
Thank
guys.
you.
See ya.
Have a great night.